Welcome to Heart Birth Center. We're located in Sanford, Florida, across the street from Central Florida Regional Hospital. We've been here for, I think, about 15 years in this location. Basically, we do prenatal care, labor, delivery, postpartum, and well woman gynecology. My name is Michelle Graff-Dixon. I'm a Florida licensed midwife. I've been a licensed midwife in the state of Florida since 1997. Basically, the difference between a midwife and an obstetrician is that we are specialists of natural childbirth care. So licensed midwives typically will work in birth centers and home birth practices, and some will work in hospitals, but not usually. I started my career as a midwife in a birth center over in Longwood, Florida, back in 1985. I was a birth assistant, and then I decided to go to midwifery school. I had my babies with midwives, one at a birth center, and then my next baby was a home birth. So my goal of being a midwife was to have a home birth practice, and I never expected to own a birth center or to do birth center care. I became a program director for a midwifery school of complementary medicine, and we were located in Oviedo, Florida. We had a graduating class of 12, and they all went out to deliver babies in our communities all across the state. I opened the birth center itself because I felt that there was a need for people to have a place to go and not be in their own homes. I have a team of 3 midwives here at the birth center. There's Emily Maldonado and Mary Piazzo and myself. We train midwives for 2 different midwifery schools. So over the course of the years, we've actually trained 21 midwives to go out into the community and deliver babies as well. Our birth center and our home birth practice have delivered over 4,000 babies in this community. We started doing births, of course, back in the 80s. A lot of people ask about the services that Heart Birth Center offers. We do prenatal care, labor, delivery, postpartum, natural birth, of course, water birth. We do ultrasounds in our office for pregnancy confirmation, and we also do all of our labs here, so you don't have to go someplace else. We do a really neat well woman gynecology visit. You know, that's a little bit different than going to an OB's office. Typical pap smear, labs, some diet counseling, and future birth planning. A lot of people come to a birth center because they want to have more one-on-one care with other women who've also had a baby. They might want more control over their birthing situation that they don't feel like they can do in the hospital. They would like to have more freedom in their birth experience, such as moving around in labor, getting on the birth ball, getting in the tub and having a water birth, walking around outside, eating in labor. Eating in labor is important. Moms would like to eat and drink and have who they would like at their births. That is a really big issue at this point for the state of Florida patients. A lot of hospitals are not allowing others in for the birth experience. And one of the biggest reasons I think a lot of people come to birth centers or with midwife care is to have continuity in care with people that they've built a relationship with.